Street medicine. We've all been to a doctor's clinic or a hospital, but what happens when we take the practice to the streets? All across our country, there are street medicine teams that are serving the homeless and providing medical care. In the Lehigh Valley region of Pennsylvania, it's the Lehigh Valley Health Network Street Medicine Team. What do they do? Why do they do it? We'll be sitting down with two of the members of that team to discuss those questions and more. That's all coming up right here, right now. I'm Sam Chen, and this is Face the Issues. Good evening and welcome to Face the Issues. I'm your host, Sam Chen. We've all been to a doctor's office, a medical clinic, or a hospital. But what happens when they take the practice on the road? All across our country, street medicine teams are serving the needs of the homeless. In the Lehigh Valley region of Pennsylvania, that is done by the street medicine team of Lehigh Valley Health Network. And so I'm pleased tonight to welcome Seth Campbell and Bennie Eliason, two members of that team, as we talk about what exactly street medicine is. Seth, Bennie, welcome to Face the Issues. Thank you so much for being here.
Thank you for having us.
Absolutely. Let's start 30,000 foot level. In the intro, we mentioned that this is something that is happening all over the country, internationally, that there are these street medicine teams. But if you go to a supermarket, any public area, and you say, hey, what's street medicine? You're probably going to get a lot of blank stares. So what is street medicine? How do you define it? How do you, when someone says, what do you do for your job, what do you tell them?
So street medicine is really born from the idea that everybody matters. And going off that principle, we go to see anybody experiencing homelessness or at risk for homelessness, wherever they feel comfortable, whether that's on the streets, in the woods, wherever they are, we go to them.
When you say experiencing homelessness or they're at risk of homelessness, how do you define that? Where's the risk? Like, what is there a statistic we're looking at? How do you decide who your clientele is?
So anybody that doesn't have a key to a door that they close behind them at the end of the night, we consider them to be homeless. So even if they're couch surfing somewhere but they don't have a key to that home, we consider that homeless. If they're living out of their vehicle, if they're staying in shelter, or even if they're staying in a hotel, we consider that homeless.
Okay. And how would street medicine, I mean, we're going to get deeper into this, but just in general terms for now, how would street medicine differ from what we might call traditional medicine, where you go to your doctor, you go to the hospital? Obviously we'll say that we have a need, we see the need, but you go to the need as opposed to the other way around. What kind of differences play into that?
Well, simply as you said, we go to the people and we bring all the services to them and try to break down the barriers, because the three main reasons that our folks don't access healthcare the way the rest of us do is, one, lack of transportation. So they don't have a car, or maybe they don't have a bus pass to get to their appointments. Two is lack of insurance or lack of ability to pay, which we help them establish insurance, and all of our services are free, including medications. And then lastly is lack of trust in the medical community. So we try to build trust. Sometimes it might take years for us to build that relationship for somebody to call for help medically.
Mm-hmm. And I think that's something that I know the first time I heard you say that, it's just something that didn't occur to me, that people who are homeless often have a lack of transportation. Mm-hmm. And it's especially in the Lehigh Valley. I mean, you go to somewhere like New York City, it's a walking city, it's easier to get from clinic to clinic. Here in the Lehigh Valley, that's not going to happen. The idea of lack of insurance, again, something that we kind of take for granted and we don't necessarily think and process through, that would be a barrier for someone to be able to actually come into a clinic. Along the lines of you going to see your patients as opposed to your patients coming to see you, where does this take place? You mentioned earlier streets, woods. Where do you go to see patients?
I mean, we go wherever they're comfortable.
Okay.
One of the things that Seth didn't mention that I feel is really important is that there is a lack of shame, or that rather there is shame. And that's a lot of times why they won't go into a traditional clinic. And so if they're comfortable in the parking lot, if they're comfortable on the back seat of one of our trucks, so be it. And that's where we're going to see them, as long as they're comfortable. That's the main point.
And how do you find them? I mean, there's homeless shelters, we know that, but you guys do more than just visit homeless shelters.
There are homeless shelters. I think anyone can agree that there aren't enough,
Right.
specifically for women in the valley.
Yes. Yeah.
However, we literally go out there and just hit the pavement, and we introduce ourselves, and we make sure that we're not there they understand that we're not there to pry or push or make them feel uncomfortable. We just want to make sure that they understand we're there to make sure that they're taken care of medically.
Yeah. How vast of a challenge is that? We'll get into some of the specific challenges, and you alluded to some of them with lack of trust and so forth. But how broad is this? I mean, what region do you cover, and how many patients are you seeing?
So we cover Allentown, Bethlehem, and Easton for the most part, but we go up into Catasauqua, Whitehall, down into Center Valley, all the way down to Quakertown. So it's a lot of space. So just getting around, that takes up a lot of time. But you know, we are obviously just in Pennsylvania. So for Easton, you know, we don't go over the border at all. So we have to be in Pennsylvania.
Oh, okay. Is that because of licensing reasons?
Correct.
Yes.
Okay, so you couldn't go to Phillipsburg.
Correct.
Not at all.
Okay. What if, and again, this is a hypothetical, it's a legal question, and don't feel like you have to answer it. What if you have someone who's in Easton and they're technically living in Phillipsburg, but they are, I mean, is there a way to check that, or is it more of you guys can't cross the border and go into New Jersey?
I mean, it's usually, or at least some of the folks that might be staying in Phillipsburg might come over to Safe Harbor, which is one of the shelters in Easton, where we hold a clinic on Tuesday nights and also every other Friday morning, at least the first and the third Friday. And we don't really question that because, you know, we're trying to look after anybody that's experiencing homelessness.
That makes sense. What kind of challenges, I mean, talk about homelessness, and you deal with the homeless population day in and day out. And I think everybody knows, to your point earlier, Bennie, everyone knows that they face problems. And generally speaking, everybody understands, hey, we're here to help. You see the Salvation Army do it, you see Goodwill do it. I mean, so many different groups that are out to help those who are underprivileged, who are homeless. What are some kind of the challenges that they face that you've seen, maybe medically, but even just in general? What are challenges that they face? Are they similar to the challenges that others face? And what are specific challenges that are unique to them?
Well, one of the things that we definitely encounter with our patients is the fact that they're not concerned, like, you know, we have a file folder in our home somewhere with our birth certificates and our social security cards and things of that nature. They're not concerned with that. That it doesn't matter to them if they have those documents or not, really, because that's not important. What's important is that it's going to be below 0 degrees outside tonight, and I need to know how I'm going to stay out of the elements. So, and it's kind of a catch-22. You can't obtain an identification, even a state identification, not talking about a driver's license, without a birth certificate or without a social. But you can't get either one of those without an identification. So, you know, we kind of find ourselves working we have amazing community partners, so I have to put that out there. And so we find ourselves kind of going in this circle, trying to figure out, okay, well, let's go back and try to reach out to your high school and see if we can get a transcript, because, you know, you kind of have to build this who I am. So that we can help them get to point A. Not having an address to receive mail is one of the most horrible things that we've encountered, because they can't get mail, so they can't apply for medical assistance or food stamps. They can't get a phone through the government lifelines. They can't get any of these things, so they're kind of still being unseen. So with our community partners and with Lehigh Valley Health Network as a whole, we were able to now incorporate, or at least the hospital gave us an address that we can use for our patients. So our patients are able to use this address, and now we've seen probably about an 80% increase in COMPASS applications, which are food stamps and Medicaid and things of that nature. And so now we're able to get our patients seen again.
Wow, and that's something that I don't think every day, you know, you go to work, you go to shop or whatever, that people think about. The idea that, I mean, there are so many benefits that the government provides, that nonprofits provide, But if you don't have an address, if you're not seen, then you can't even access the benefits that are being made available.
Correct.
How does that, I mean, obviously with the Medicaid, you had mentioned that earlier too, so many of your patients don't have insurance. How does the situation, the challenge that they face, how do you see it then impact their health?
Well, to kind of wrap up that discussion, their main focus is survival. So all the creativity that people might be able to have during their regular workday is not really an option.
Sure.
It's get up, get out, where am I going to eat and where am I going to stay that day? So it's difficult to focus on your blood pressure, even though it might be 200 over 120. You know, to take that pill, or maybe the medicine you're supposed to be on makes you tired, and you don't want to be vulnerable in the streets. So if any of the medication makes you dizzy or tired, then you're not going to take it.
Right. Let me kind of bring this part of the conversation to a close by asking you've been both of you have been working with the homeless population. You've been providing services. You've interacted. I remember distinctly sitting with you at a coffee shop, and there was a gentleman who I think had been a past patient. And Seth just says, "Hey, hold on a moment," goes over and provides medical care, which I thought was the coolest thing. That this is someone who is really at every moment, even though you were off work at that point, where you're still being an agent of change in that sense. What would you say, and you've laid out so many different things, but what would you say to the public? I know you both do public presentations. When you present on this, what would you say to the public? What would you want them to understand about the work you do, but also about the homeless population that you think is often just misunderstood or left? Like there's a gap of understanding there.
For me, it would be acknowledge their presence. See them. They're just like you and I. Respect them and understand that there's a hardship, and any one of us can fall into that hardship at any time. You know, like I told my kids growing up, we're one paycheck away. And so we just have to be grateful and remember that we have to give back and that everybody is a person and everybody's human.
And as far as the stigma that might go along with being homeless, you know, it's just really not true. They really are hardworking folks with backgrounds that, you know, are close to home. The majority of our patients are, you know, a mother, a brother, a father, a sister to somebody in your neighborhood here in the Lehigh Valley. So, you know, they're really not, you know, any different than anybody that stays in a home at night.
Absolutely. Thank you guys for that. Don't go away. Hang out. Keep hanging out with us. We'll be right back. Welcome back to Face the Issues. Seth, Bennie, thank you again for taking the time to be here. Before we go in this segment, kind of want to introduce what both of you do for LVHN Street Medicine. Seth, you're a physician's assistant. Tell us a little bit about kind of what that role looks like with street medicine.
So I'm the primary medical provider. So after they see our nurse or have intake through our administrative coordinator or through Bennie, our community health worker, I see them just like any other physician assistant or provider in a regular office, although sometimes, you know, I'm out in the woods.
Fair enough, fair enough. And then as the community health worker, what does your job entail?
So I work really closely with our social workers at Lehigh Valley Health Network and all of our community partners, and just make sure that I bridge all of those partnerships, and that's for the benefit of our patients. And then I work with all of our social workers for all of those social aspects that are really holding our patients, you know, in a position that they can't move forward.
Sure. So you're the glue that holds the whole thing together.
I try, yeah.
Talk to me about your team at LVHN Street Medicine.
Okay.
Who else is involved? How big is that team? I mean, is Seth the only one doing rounds?
No.
Or how does that work?
That would be interesting, though.
Always out in teams.
No. So first off, we have absolutely amazing CEO that supports our program from top to bottom. Amazing administrators, from our medical director to our department administrator, and all of our administrative support that goes along with that. And then we, of course, have our team. So our team is comprised of Nani Quadrado. She is also a physician's assistant, and she is the director of our program. And then, of course, there's Seth, who is a physician's assistant as well. You have Stacia Horvath, who is a registered nurse as well as our clinical manager. You have Patrick Smith, who is our administrative coordinator. And then you have myself, who's a community health worker. But we cannot leave out the fact that we have two amazing per diem nurses, Julie Moyer and Carol Kirkham. And so they are great at working our night clinics and just a bunch of things for us. And so I can't leave them out. But most of all, we have such support from our departments at our hospital. Every department, from our internal medicine to our family medicine to our emergency department. We just have so many volunteers that want to help, and in all facets, not just being, medical providers, but we've got social workers, we've got scribes, we've got translators, we've got, just anyone in a hospital comes out and they want to help us.
So when you do go do your rounds, when you do your services, you have doctors, residents, scribes, translators who are not assigned to this team. This is not their day job.
Correct.
This isn't, they're not being paid for this.
Nope.
And they're coming out on their own time. And we know how little of their own time doctors and residents have. Yeah. But they're coming on their own time to go with you guys and to do the work. That's incredible.
Yeah. We've had ED staff come work, a 15, 17-hour shift, and then come in at 8 o'clock the next morning to go on rounds with us.
Right.
And so it proves the dedication that our staff at LVHN has for our patients.
Right. And I understand that you mentioned Brian Nestor, who's the CEO of LVHN, who's also a doctor himself, as is his wife, and both, as you mentioned, just phenomenally wonderful people. I want our viewers to make sure you're not just saying that because you work for LVHN. No. I don't work for LVHN, and I can attest that the Nestors are remarkable people, and they've come out and done rounds. True. And it's a complete team effort.
Absolutely. Absolutely.
We discussed some of the differences between street medicine and traditional medicine. The main one obviously being that your patients aren't coming to you, you're going to your patients. One of the curiosities I think that everyone has when they first hear about this is, you go to a hospital, there's a whole bunch of equipment, state-of-the-art medical equipment. How do you take that out of the hospital and into the streets and into the woods?
So one of the calling cards of street medicine is the backpack that might be rather large, and anywhere I can get my stethoscope and my backpack's a clinic. So I carry an on-site pharmacy with over 20 medications, high blood pressure medications, antibiotics, diabetes medications, inhalers, and I can dispense that on site to the patient, and that's really the only way that I know that they're able to get the medicine.
Wow. What kind of things, so you bring this backpack with you, right? You have medicine in there. I see a stethoscope. Are you carrying other medical equipment with you? Like, when you see the patients, you perform the medical care right there and then?
Right there, yep. So I've got 3 different sizes of blood pressure cuffs, thermometer, and everything from that to a machine that'll give 2 lead EKG and send it straight to my phone, which is really useful for diagnosing things such as atrial fibrillation, and we can diagnose that on site.
Wow. Yeah, usually an EKG machine is massive, and they have to wheel it into the room. There's 50 hookups, but you're able to take that right into the field.
Yep, and we have another device that does strap around the patient and provide a 12 lead EKG, which is the full one.
Sure.
But it's kind of difficult to use that, especially in the colder months, because the patient has to take off their jacket and their clothes so we can wrap it around their chest. So this allows us to just use their fingers, even if they have to take off their mittens for a second.
Sure.
And then make sure their hands are toasty warm with some hot hands on the inside of the gloves.
Yeah. What kind of results have you seen doing the street medicine program with the patients? Have you seen them? Have you seen health improve? Have you seen them, or even their own lives, have you seen a transformation process? What kind of results have you been seeing?
So we've definitely seen improvements, and we've definitely seen people go from a level of homelessness to being housed. And so I take a lot of pride in this team because we work diligently and we work together, and we have literally taken patients from being homeless and having to have surgery and having amputations and things of that, those types of barriers, to now being housed.
Yeah.
and receiving the care that they need the way they should be receiving it.
And as a program, we don't do the housing, but through our community partners like the Conference of Churches and Ripple Community Inc., there are best advocates as we are theirs, and they have those services that we can advocate for our patients to get them indoors.
Yeah. And Seth, you mentioned earlier too that there's a distrust sometimes between the homeless population and medical providers. Have you seen that change as you get to know them better? And I mean, do you have follow-up appointments? Is this do you come back to them? Do you see the same person? Right. Every time I go to my doctor, there's a chart, right?
Yeah.
And I mean, does this happen in street medicine as well?
So also in my backpack, I have a laptop and a full-size iPad with a MiFi device to connect onto our electronic medical records, so I can chart right there out in the field. Even if drop a tailgate in the truck and the patient's sitting there, I can put my laptop there or the iPad and access the chart and send orders to the pharmacy and make sure they get there, put in referrals. I can do that all right on site. So, I mean, it's everything's available at my fingertips.
That's incredible. How have you seen, I mean, the program's been around for how many years now, right here at LVHN?
I think we're pushing 6 years.
6 years. How have you seen it grow over that time?
So originally it was a physician assistant, a nurse, and an outreach worker. It was Brett Feldman, the founder, the PA, Laura LaCroix, the nurse, and then Bob Rapp, our outreach worker. And now we're a full team of 5. And again, with the plethora of administrative help that we have, that's really grown. And then even the services that we provide. We have more clinics than ever. We're doing more street rounds outside than ever, and we still have the consult service in the hospital. We also are delivering telepsychiatry via the iPad with a behavioral health specialist that we bring to the patient. And then lastly, we'll be coming out with medical respite in a hotel where somebody that's not sick enough to stay in the hospital but not healthy enough to be on the streets can recover.
Wow. That's incredible. That's incredible. Thank you guys again so much for really, I think, opening the eyes of so many people to the homeless population and also to the work that you guys do. I really appreciate it. Thank you. Don't go away. We'll be right back. Welcome back to Face the Issues. Seth, Bennie, one of the things that we love doing on Face the Issues is we love highlighting who we call our heroes in our community. And certainly both of you, the work that you guys do through street medicine really embodies that. Let me ask you this. Why do you do what you do, and or what gives you the greatest joy in your job?
I'll take it. That's
a good question.
For me, growing up, I grew up in a really not so good neighborhood in New York. And for me, I didn't see a lot of opportunity. But what I did see from time to time were social workers. And I saw caseworkers, and I saw outreach workers. And that just kind of always stayed in the back of my head somewhere. And then as I got older and had my own children and realized I was not in a field I needed to be, and then started volunteering, because that's how I really got into the social services aspect, I realized I really, really want to make a difference in the lives of people that others don't see. And I think it's because I felt like I was one of those growing up, one of those people, so I wanted to make sure that I don't treat others that way.
Wow. Seth?
Well, I've had a lot of, support through mentors throughout the years, and, through starting as a student with Brett Feldman almost 4.5 years ago, I saw the suffering that's out there, and I just couldn't turn my back. So, I've been very fortunate that we have Valley Health Networks giving me the opportunity to see our patients, but also that our patients allow us to see them, because, a lot of our patients feel like they're invisible. And, and they feel like they're lonely, and there's nothing more lonely than feeling invisible. And I've legitimately told a patient as simple as, I see you. And they just start crying. I'm like, don't cry. Don't
You cry, I'm going to cry.
Yeah, you're not crying. I'm not crying, you're crying. But ultimately, by using the tools that have been taught in medicine to be able to lessen suffering out there and kind of redefine success, it's just been a joy.
Yeah. Let me close out this question. What kind of needs do you guys have as a program? How can someone contribute, whether financially, or if we have people watching this saying, I'd love to volunteer, or I'd love to do a drive for them, or have them speak at my community group or something like that. do you guys do that, and how should they go about that?
So actually, we do all of the above. Whether it's speaking and just educating the community or school or however that works, we can do that. We always are grateful and accept donations, whether it be financial donations or just survival items. You know, tents, tarps, sleeping bags. Those are things that go quite frequently. Gift cards, because you know, if somebody needs something and we don't have it, we don't have the storage space to hold it. That's what, you know, we could use that. And really the way to do that is send me an email.
Okay.
So I don't know if you can post that.
Yeah, we'll get it up on the screen. And just what is that email?
Bennie.Eliason@lvhn.org.
So, well, thank you to both of you. Thank you to your teams for what you guys do. I think it is incredible work and incredibly important work. And I'm very grateful for the work that you guys do. And thank you for sharing that with us.
Thank you.
Thank you.
Absolutely. That is all the time that we have tonight. My thanks to Seth and Bennie and the entire team at LVHN Street Medicine for the work that they do day in and day out. And if you want to be a part of that work, email Bennie, and I'm sure there's opportunities that they can present to you to be a part of the work that they're doing. That is all the time that we have tonight. Thank you so much for tuning in. Join us again next week as we look into another issue. My name is Sam Chen. On behalf of all of us here at Face the Issues, thank you and good night.